Basic life support is an emergency measure which will buy the patient a few minutes of time. It provides a small amount of circulation and oxygen to the lungs, but even the most effective BLS does not replicate the heart and breathing. BLS is not aimed at restarting the heart, and in most cases it will not. This is what an AED is used for. For BLS to work, it must be done with correct technique to ensure maximum efficiency. The better your technique, the higher the chance of survival. BLS is comprised of chest compressions and ventilation breaths, which are done at a ratio of 30:2. Early BLS will normally be followed by other treatments, which depend on the patient's condition. When you approach an incident, always remember to check for danger, such as trip hazards or sharp objects on the patient. Once you have approached the patient, perform a shake and shout. If they're unresponsive, call for help. Then, check the airway and if necessary, clear. Check for breathing and pulse. Feel for the carotid pulse on the neck. Sometimes this may be difficult to reach, so if you cannot and they are not breathing, begin CPR anyway. To begin CPR, remove any clothing that may be obstructing the chest. Begin with 30 chest compressions, which are performed in the centre of the chest on the sternum. When performing compressions, keep your arms locked, pressing down around 5 to 6 centimetres at around 120 compressions per minute or 2 per second. They should be hard and fast. Do not worry about damaging the ribs. After 30 compressions, perform 2 ventilation breaths. Remember to tilt the patient's head back and lift the chin. Use the pocket mask to avoid direct contact with the patient's face. Once you have performed the breath, watch for the patient's chest falling. Continue the ratio of 30:2 until help arrives.